Guys, without further ado, let's go ahead and get started because I know Janet and Dr. Chatlos, you have a lot to discuss today. So I want to make sure that we have time and it's not rushed. So welcome everybody. This is First Responder Friday. I am super excited to be here and more excited that I love these people that are on and all the work that they're doing. And I'm talking about some trailblazing stuff, which is what we love on our First Responder Friday, Janet and Dr. Chatlos. So today we're going to kind of be like a part 2. If you joined last time, this is kind of an additional piece to that. You can go back and check out that recording as well. But we're going to talk today about, are you aware of religious and spiritual experiences in the mental health crisis, in addition to moral injury and community crisis care? I am super excited about this because we're starting to finally talk about moral injury in the first responder realm, but this is going to take it even a step further. And I'm going to let the 2 people that are going to be on here today, Janet Werner and Dr. Cabelin Chatlos, are going to introduce themselves briefly, and then they're going to get started with today's training. If you have comments, questions, concerns, feel free to pop them in the chat. I will monitor that throughout the training. I will get them at the end if I miss anything. If you have something to add or say, you can use the raise your hand icon that's down in your reactions at the bottom bar. If you have something to say and it's and we're asking for questions or somebody to unmute, feel free to unmute at that time and ask your question. I'm going to go ahead, Janet, and I'm going to turn this over to you and Dr. Chatlos, and I'm super excited today. Thank you.
Excellent. So yes, this is a return from April 5th when we first introduced AWARE. So I'm just going to ask either raise of hands or comment in the chat. Were you there when we first introduced this? That was, I might call, a light introduction. We just walked through some experiences and introduced the concept. Today, we have Dr. Cabelin Chatlos, who is a business partner, has been for a few years, both on the whole AWARE movement to raise awareness around the country, really around the world, that religious and spiritual experiences are a part of mental health in a proactive and a reactive. And so I'll start with Dr. Chatlos, if you just provide your brief background before we put the slides on to introduce yourself.
Thank you, Janet and Olivia, and welcome. I'm Dr. Chatlos. I'm an addiction and a child and adolescent psychiatrist. I'm currently operating in New Jersey with a addiction residential treatment center called Avatar, and I'm affiliated with Rutgers University, and much of my work in addiction has led to the interest in spiritual experience and spirituality. So that's part of my interest in bringing this to the forefront.
So Dr. Chatlos and I are partnering again now for a few years, very specifically on taking my experience of spiritual and religious experience, where it was shut down, locked up, drugged, and halted from what would have been a natural experience. I was put in a mental institution when having just, a really nice spiritual awakening. We'll get into that in a moment. It brings me now 44 years later, leading a docuseries and a feature movie. And we'll talk about that at the end. One of our main things right now is to just raise awareness around the country, around the globe. So I'm going to open up the share screen and show you our slides. The question is, are we aware? And that's what we'll ask you to think about. Are you aware? Are we aware of religious and spiritual experiences in mental health? And how do we prevent the moral injury when it's a good experience and it gets shut down? So there's 3 parts to this meeting today. 1, religion and spirituality is alive and well in the United States, is alive and well around the world, and has been for thousands and thousands of years, probably since the beginning of time. And that's perspective. The next one is religion and spirituality is actually being included in mental health and wellness initiatives. That's good news, because some of the examples we'll share down the road, when many of us were going through spiritual experiences and then what we call incarcerated in a hospital system, there was very little known, very little integration. So the second point, that it's being integrated into health and wellness, Dr. Chatlos will speak about. The third point, fourth on our agenda here, is we want to go deeper into when a spiritual experience turns into a crisis, into emergency. And what does that look like, sound like, feel like? But then how do we respond to it? And we're going to bring in one of our colleagues, Carlito, who's here, to also comment and open up a conversation. The big one is, how do we prevent moral injury when something good gets locked up? And we'll close with next steps. So Dr. Chatlos, why don't you start to give us some of the basics for perspective?
Yeah, thank you, Janet. This slide actually has information from the Fetzer Institute in 2021. And what they did was, in America, ask questions. To what extent do you consider yourself a religious person? And to what extent do you consider yourself a spiritual person? And you can see what the results are. 70% of the population identify with religious or spiritual. And you can see the numbers are large. We often keep it in the background, and that even in mental health services, we keep it in the background. We don't talk about it, but so many people, so many of our patients actually come from and remain connected to some degree with a religious or spiritual background. Janet, you want to go to the next one? And this is what it looks like in probably the broadest perspective in America now. The date is 2014 because we have not had recent updated ones of this. Actually, we did have one a couple of years ago, and these figures are maybe within 1% of what it is currently. And you see that the predominant is Christian. And I guess to bring attention, not so much to the different denominations, but there are what we're calling religious nuns and unaffiliated. And we'll talk about that because even people without the religious background can still have what we identify as spiritual experiences. So it isn't just religious. It is somewhat different. And I'll be talking a little bit about what is the distinction between those two things. And down at the bottom, I think is very interesting. 45% of Americans have had what they say a sudden feeling of connection with something non-ordinary, something from, they use the words beyond this world, but it really refers to what we describe as non-ordinary experience. And 30% say they have encountered a spirit or some sort of unseen spiritual force. So there's a very large awareness out there. And as Janet will, I think she'll personally talk a little bit about it, when someone opens up into that spiritual experience, it often isn't understood. And I'll describe in a slide what it looks like. But I think that's all I need to do with this slide. Want to go ahead? Janet mentioned that it is being, the whole idea of spirituality is being brought into not only mental health, but education. This comes from the SAMHSA, the Federal Substance Abuse Mental Health Services Administration. And it's been present, I guess, for almost 15 years, where they have the different domains that go into wellness, but they've identified and added spiritual. Now, one of the things, at least in my work, especially in addiction, we're recognizing that spirituality as a real experience probably plays much more of a role than we're recognizing in mental health, not just in addiction. So part of my interest is in getting out there the reality of spiritual experience, and then what do we mean? What do we mean? Why is it important? Because there are just so many ideas, and we've got a lot more new knowledge, just, I would say, in the last 10 years. Part of it, believe it or not, is really being driven by the psychedelic. The psychedelics research, as it's soon to be, hopefully, approved for treatment of PTSD, trauma, and depression. But so just so that you can see, spirituality is being recognized as part of the whole process that's part of human wellness. And this is probably the message that I want to get across most, that spiritual experience is real, and it's more real than we thought. And the work, as I mentioned, psychedelic research demonstrates that spiritual, and we'll talk about the word mystical because often they're used interchangeably depending on the situation, especially in research, that spiritual or this mystical opening to experience can be predictably promoted at this point. And the psychedelic research shows the neuroscientific basis. It shows some of the regions of the brain that we think are responsible for the opening to this spiritual experience. And over the last 10 years, there's been quite a bit of research, not so much clinical research, but statistically and looking at personality. There are 5 main factors to personality that seem to explain everything. However, the most recent research suggests that spirituality independently is a separate factor of personality. And this has only probably been identified 5 or 6 years ago and really isn't out there. And what some of the work I've been doing is recognizing how spirituality is actually organized in our experience. We're beginning to identify a specific language that allows us to intentionally move into this. I see a question. Can you define, I'm going to read it. Can you define spiritual versus religious? And Jenna, that probably should be a slide we have at the beginning. When we're talking about religious, we're usually talking about something to do with beliefs and practices related to an institution or a specific tradition, where spirituality and spiritual experience is personal. Now, spirituality, spiritual experience may be associated with religion, but it may not be. That's why I said there can be religious nuns that, including atheists and agnostics, that can still have the capacity and have these spiritual experiences. Another term you might want to be aware of that's getting in the public and in the literature is what we would call religiousness or religiosity. These are people that may have religious or spiritual practices, but don't identify with a specific tradition. Someone that does yoga but isn't Hindu, someone that meditates but isn't Buddhist, someone that prays but doesn't necessarily identify with Christianity. So those are the different terms, and try to separate what they mean. So I'm sorry, we should have added that at the beginning. And then finally, as I've mentioned a couple of times, that psychiatric research now has literally demonstrated the ability to intentionally promote spiritual experience and spiritual awakening. And I might as well, since I've used that word awakening, awakening is what we use when someone has one of their first non-ordinary, what we would call spiritual experiences. And it is, I think, put on the next slide. I think I have the description. Yes. This is a description of what we're talking about. Now, I mentioned and talked about and defined spirituality. Mystical is often used interchangeably, and mystical has to do with the qualities and the characteristics that often come with that opening. And another term that we're beginning to connect with this is numinous. It's interesting. The word numinous comes from the word Latin numen, which was to nod, in terms of nodding to the divine. So let me just, as I've mentioned, we're talking about a non-ordinary experience. And it often has wonderful feelings, an ecstasy, a sense of newly gained knowledge, as if the reality, this knowledge is, it's not usual, it's not what I'm used to, but there's something important about it. It may get extreme. There may be body sensations, there may be perceptual alternations, there may even be hallucinations, but this is not schizophrenia. This is not a typical psychosis or bipolar disorder, but we'll talk about that. And there may even be unusual thoughts, to the degree even of delusions, with themes related to often mythology and maybe with religious traditions, and often also with just certain literature if people are readers. What's key is that with these unusual and often misperceived experiences, the person's thinking is still not severely disorganized. They can carry on a conversation. They can talk about what's happened before this experience, even if they can't quite understand what happened. There is an absence of the cognitive disabilities or deficits. You can carry on normal information gathering even in the middle of this type of experience. And something that's very important, usually with spiritual or religious experiences, it's very, very rare that they are associated with suicidal or homicidal ideation, which as first responders is our immediate concern. So this is what we mean by a spiritual or mystical experience. And these are just some of the characteristics. And advance the slide, because there's a message that this experience may progress. If someone doesn't quite understand what they're going through, it may become a crisis just out of confusion or disorientation. And it may even get, as I mentioned, with severe delusions, with hallucinations. It may get to the point where the person may start to panic because it's an emergency. It really may get frightening. And this is when these experiences often get misdiagnosed as either medical or mental disorders. And what I hope we don't get too caught up in the pathology and whatever, but the real importance of what Janet and I and this team are trying to do is that these are missed opportunities for true personal and spiritual growth and even transformation. So that it's not just let's avoid doing damage, let's help to identify what may be the beginning of a new day, a new direction for that person's life. Yes. Where the field is in terms of mental health, this is the DSM, the Diagnostic and Statistic Manual of Mental Disorders. And we asked the question, well, we see where SAMHSA includes spirituality. Well, where does mental health, where does psychiatry? And advance it one more. There's a very small piece in the back called additional conditions or problems that may be a focus of clinical attention. And specifically, advance to the next one. There's a specific V or a code called religious or spiritual problem. Now, one of the problems is we want to quickly diagnose, is this depression, is this anxiety, is this bipolar disorder, and pass on the information to the next treating professional. we are emphasizing that, okay, well, that may miss the main point. If this in any way is connected with a religious or spiritual experience, how do we communicate that to the next person that's going to be picking up the chart, or the next person we're going to be passing the patient or the client off to? So this is a chance to use religious or spiritual problem just in terms of communication, as well as, okay, yes, this is an additional condition that does need attention, has some connection with whatever the diagnosable mental disorder may be, if there is one. And I think there may be one more before you take over. Nope. Janet, I think
There we go.
that's my point. I'm good to go. You can take over and carry it into the moral injury. Thank you.
Excellent. So I'm going to keep my story brief. One, because I shared it a little bit in the April 5th one, and two, come and watch the documentary and movie. You'll hear on more detail. I had two spiritual emergencies, one in 1979 and one in 2005. They didn't start out as an emergency. They started out as like an amazing Holy Spirit, 100% Christian-based encounter. And while I did understand it and I was not confused, I didn't know how to speak about it. And I didn't have anybody to speak with. So 79, I was 25. And so by holding it in, it eventually turned into an emergency. And part of our mission is to really raise awareness that this is real and we can talk about it, and, you know, it's not a mental illness. My second one happened in 2005, and that's like a 25-year span where I did not have mental illness diagnosis. I was highly successful in business. I was not required, or I didn't comply with taking any psychiatric meds. But kind of just a very simple thing is I had a business failure and I turned it around in a year. I'm up on Wall Street and I'm presenting how to make people aware of this. So in 2005, I was really called to start speaking. That all worked well. It was brand new for Wall Street investors to hear about this, to hear that it's in the DSM, to hear that medical doctors need to be trained, etc. The problem came when I went home and tried to explain this to my mother. And God bless her, you know, she was trained in the narrative that I guess non-ordinary experiences are mentally ill. So she kept it. And when she saw me be excited and inspired, she immediately went to a misdiagnosis from 25 years ago, called the police, and had me brought into a mental institution. That's the short piece. So 9 days after Wall Street, I'm in a mental institution talking to my Wall Street colleagues on what are we going to do about this. I want to go into the moral injury of this and actually ask the group, you know, what do you think is the moral injury of me being misdiagnosed, locked up at 25, and then again at 50, when it is a true spiritual experience? Dr. Chatlos has already diagnosed me. I never was bipolar. I'm not bipolar. More than likely, I will not be. And so my spiritual experience was suppressed, drugged, you know, and put in a box. And it's taken me 44 years to come out now and really do something about it. So I'm going to pull the slide off for a second and just see, do we have anybody who could comment? Because we really want to get into preventing moral injury. We want to probably help some of the people who have been traumatized. One more point. We have a team of somewhere between 50 and 100 around the world who have experienced what I did. Some of them were put in the hospital 4, 5, 6, 7 times. They are also MDs now, PhDs, therapists, advocates in Washington, teachers, trainers, coaches. very, very on mission to do good, but many of them suffered because as they tried to speak that they had a spiritual experience in the hospital, they were shut down and they were given more meds. So I'm going to open it up maybe first to Carlito. You know, how do we prevent, or what do you think is the moral injury on me and or our colleagues when it's shut down? And how do we prevent it? So I'll start with you and open it up.
Thanks, Janet. So by way of introduction, my name's Carlito, as she said. I serve as a crisis counselor for two organizations, Crisis Text Line and state of New Jersey, actually, as disaster response crisis counselor. So as a first responder, I think I can respond and say, my mindset or how to help prevent, my mindset when I see someone in crisis, and if we're talking to spiritual and something of a religious crisis, before it gets there, when I'm looking at the slides that Dr. Chatlos displayed, as well as paired with Janet's testimony, what I saw was something where prior to it becoming a disorganized thought and into crisis, I think the first point for all of us in prevention is listening ears. Okay, and that's really my crisis counseling hat on right now, but that's also applicable to anyone that of our citizenship, because in my own congregation, I'm training some folks too, just in my church, and out there, they're more aware now. They see some people, even if they're, there's a case scenario where there's an individual just panicking because they were being yelled at it by a boss, and they're driving around in a truck and they're trying to deliver some product, and the person, went off to the side and got out of the truck and was in panic, right? Just by being yelled at, cursed at, F-bombed, right? So she applied listening ears and knew the person's going through something, right? So the listening ears does this. It validates the emotion. So in Janet's testimony, like there's some sort of emotion that's bubbling up before it gets into disorganized thought. There is something there that we can identify with and just have listening ears, because what it does for that person is it validates them if you're listening to them, and it helps them understand, like, okay, there's something going on here. And with the case scenario of that person I just described, somebody who's helping out this truck driver, is putting a hand on the person on the back, just like, you're going through a lot now, are you okay, right? And the crisis counselor also wants, like, to deal with the emotion, but the goal they're trying to get, and however long this conversation takes, whether it's with me in Crisis Text Line or disaster response, sometimes it's 45 to minutes to an hour. It's just getting to them calm. When you get to the calm, that's when you can actually insert and achieve calmness, and with that also empower the individual. So I guess prevention to me means listening ears first. It does validate that what the person is going through is something to them that is disjointed, dislocated, right? Emotional, right? In crisis, everyone has panic, anxiety, depression, et cetera, I'm not looking at the weeds of how it happened, or maybe I should bottle them up, right? Put them somewhere away, right? And I think first responders, you guys do a great job when you can get to a moment where you could say, hey, listen, before it gets to that, what can I do to help them, first of all, achieve this calm, and then empower them? And so the other thing we try to do too is make sure there are resources available that they can go to sort of carry out this process they need to get to. Like maybe Janet just needed to get to a process to continue with the calm and stay out of the disoriented in order to communicate what that spiritual emergency is. So, I mean, that's just part, like, sort of, how do I say it, Janet? Like, part of my mental health crisis alert system going on in my lens, right? But then also just, I think Dr. Olivia Johnson, she talks about this a lot too, is just having empathy, right? Just having empathy, but realizing if the person has emotion, let's actually divorce that through what they're going through, what we can see in the eyes from our sort of a naked eye test, and maybe if they're going through some sort of disjointed event, but that's just real. It's real to everyone what they're going through. It's valid what they're experiencing. Reach out and get to a calm, and then we could start empowering them into the process of getting to the next step. Now, that's how I wanted to start. Hopefully that was helpful.
Thank you, Carlito. That's been consistent as we've talked to clergy, to first just stop, listen. And I want to really focus this in on when it's a spiritual, religious, mystical experience, it could be odd. It's an odd, unless you've had it yourself. My mother thought I was on drugs. I'm like, nope, never been, not on it. So it looks different. It's experienced different, but it still can call for what you and Dr. Olivia had said. It's just like, we got to stop, and Dr. Chatlos too, we just got to stop and hear it. And what we're trying to do today is raise awareness that religious and spiritual experiences are real. And even when they're extreme, many of you probably know Ernie Stevens in Crisis Cops, the HBO movie. And Ernie has seen hundreds of cases where someone is going through what he calls hyper-religiosity. And that is easily seen as a bipolar, schizophrenic, or some just like, let's just take this person, might lock them up. But Ernie has really gone on record so many times to just say, let me just stop and understand and ask some questions. So I'm going to invite, if people can comment or ask questions, because we really want to get into the moral injury. Dr. Chatlos, before we finish today, you can comment on where we're going, but moral injury is coming into or being proposed to come into the DSM. And we want to really highlight, what is the moral injury when a spiritual experience that is a natural, good thing that happens, that is suppressed by a Western medical model and judgment? What is the moral injury, not just to the person, but to the family, the community? And maybe Dr. Chatlos, if you want to comment, but we really want to invite others to hear because this is brand new territory. What is the moral injury when a spiritual experience is suppressed?
Janet, thank you. Because I as Carlito was talking, I wanted to expand on something regarding moral injury. And I want to include not just moral injury that occurs in an experience with a person like Janet, but moral injury that is part of being a first responder.
Mm.
What we recognize in our work with spirituality is we literally have a core in our being related to spiritual experience, but it's got a moral core, a moral truth sort of force that recognizes when someone's worth and dignity have been injured. And what happens when it is not recognized, not affirmed, as Carlito said, just by listening, that's an injury. The moral injury, as well as we shrink, we lose our courage, we lose our connection, not only with others, but with ourselves, and we lose faith. And not faith like a religious belief, we lose faith in the system.
Mm.
Someone going through a spiritual emergency, it's so frightening that they start to lose faith in themselves. It's like, oh my God, what's going on in my mind? I'm going crazy. And if that's affirmed as okay, it can be transformational. If it's not, it's like, you're broken, you're bad, you need to be on meds for the rest of your life. That's devastating. So part of the moral injury as a client going through a spiritual experience is the injury on my core, I'll use the word soul.
Mm.
The soul, not that it's a thing, but there is a functional experience we have of the deepest parts of us that we can use the word soul or spirit, whatever we want to use. Now, I said I'd connect it real quick, Jen. I know you want others to join.
That's okay.
With first responders, you have that same moral core, and you see all the time domestic violence, homicides, where worth and dignity is absolutely damaged. Well, as a first responder, you hurt. And that's the sort of injury that underlies PTSD because it's unconscious. it's almost out of our awareness that we have such a value that's so strong that it reacts whether we're consciously aware of it or not. So, and that's part of what sometimes makes PTSD hard to treat, because treatment centers aren't addressing the soul, spiritual, moral core that's injured just from trying to save lives and help people. Does that help, Janet?
Absolutely. And I do want to invite anyone, we're seeing a lot of comments, and I'm going to ask Dr. Olivia to, kind of peruse these and see how we connect them in a moment. Anyone that wants to unmute themselves and comment on I guess the awareness of a spiritual religious experience that gets judged, medicated, and what that moral injury is. What kind of questions and or experience do you have on this specific piece?
Janet, I'd like to add that I
ahead.
think a lot of times we, as first responders, we operate out of fear. What we don't know is there's a fear behind it because you've never seen it before. Just as the person maybe experiencing this is operating in a fear component if they've never had this happen before. And I think just the awareness to this issue, obviously we'll talk here shortly about, making the scene secure and being safe and those type of things. But as Dr. Chatlos mentioned earlier, those that are having these real experiences are often not suicidal nor homicidal. So once that's established that the scene is safe, it's really taking that moment. It reminds me of when we're told constantly, if you see something, say something. And then they come to you and say, well, you shouldn't have said that. And it caused a problem. How dare you, and because it wasn't relayed in the right way, they were chastised and shamed for it. So guess what? They're never going to do again. They're never going to tell you what they see. And it's the same kind of concept. If somebody sees something and they tell you, you listen to them, you take in what they have, and you look at the evidence that's provided by you, and then you give proper feedback so that because you want them to come to you again. If you tell your child, come to me if somebody does something bad, and the first time they tell you, you just, you tell them that what they're telling you isn't true, you devalue them, you make them feel bad, they will not come to you again just out of fear. So we've got to have that same mindset when we deal with people and their emotions and what they're going through.
Well, I'm going to give you a few examples of just that. And this is the historical. I think it's still happening today, but maybe less so. My testimony and many of our colleagues around the globe, when we spoke of God on the ER, it got written in our report that says delusions of grandeur, thinks they're connected to God. And it wasn't, this list of I'm going to save the world, etc., but many of us call it the clinical gaze. The medical professionals look at us and have a clinical gaze. There is no conversation. And then we have to shut it down, because if we go any further, they're going to pump more drugs in us. And we do have our medical reports where, this is covered. We're looking to raise the awareness where that's not the first trigger. That's not the first response. That is like, tell me more. And what's good is cultural competency is coming into the therapeutic model. We need to care about your cultural views, which connects to your spiritual views. So we're inching forward. Again, I'm gonna, Olivia, if you want to look at any comments, but we'd like to invite anyone to unmute themselves and comment, how familiar is seeing a hyper religious moment out on a call? Have you ever had one? What questions do you have? And before we go, we're going to talk about our recommendations. So is this familiar to anyone? Yeah.
There is a question. Leo had a question here a little bit earlier. It said, what is the spiritual definition of trust?
Ooh. I'm tossing that to you, Cal.
Yeah, right.
Dr. Chatlos.
We could do a whole hour on just that. Trust is a difficult word because trust is a two-way street, and trust may come from me, it may be connected with others, and that's why I pretty much stay away from the word trust, and I use faith, because faith is 100% under my control. It's my choice to have faith or not, regardless of what the rest of the world does or says or whatever. So all I can say really, Leo, is trust is a necessary part of giving space for faith and for truth to come out. And that's where the listening begins, because that's an immediate sign that I trust you. Tell me where you are, what you're going through. And just giving that trusting space makes a huge difference.
Here's my input. If I could do my input, 1979, I'm 25, 2005, I'm 50, do the math. There was no trust in the system, not in anyone around me, not in my college, none. I attempted and I immediately saw no trust, do not speak, keep my mouth shut. I had 100% faith in God. I had private prayers. I remember the prayers at 25 in 2005. It's like, Lord, what am I doing now? And both were go into the hospital in compliance. Do not fight. I did not fight. I was very calm. I was given grace both times. And so faith was in my jurisdiction. And I was guided both times calmly into the ER, through the hospital and out without incident, without handcuffs, without putting in a seclusion. And that's not true for a lot of our colleagues. So I'm going to just say that too. I looked quickly. There was no trust, but it would be, Dr. Olivia, if you showed up and wanted to talk to me. But I did have my faith that walked me through. Carlito?
Yeah, I could say one phrase we could employ that has worked for me, and it was something that I was trained through actually on an active rescue response with someone who's about to jump on to the train tracks. And it got to a very heated, escalated moment where the person in crisis was, basically saying, don't call the cops or I'm jumping on this, the train tracks, committing suicide. But I worked the person to a calm. But I think this could, and I employ this and I help this with other communities where we're doing first response too, is you could try this question and it does start the atmosphere of trust, is asking the question to the person in crisis. So what does help look like to you today? Tell me, what does help look like to you today? Because I want to help. That's what I'm here to do. And what that does, it empowers the person to really think through and say, well, first, I want you not to call the 911. Absolutely. I will not do that. Right. And then it starts a calm conversation to engage. So I think that's helped a lot when I've gotten into very extreme cases of active rescue. So you could try that phrase. Very much could help.
I love that, Carlito, because it gives them back the value that their opinion matters and that they know that they need assistance, but they need to know what they need in that moment. I love that.
Yep.
And I'm going to build on that, because if we keep focusing it back on the religious, spiritual experiences that might be extreme, we want to advocate, do you want a clergy call? Do you want your spiritual leader called? And that is brand new. It's not happening. It's not a standard right, but that's kind of part of the movement. We want to eventually get into legislation, but right now we want to be able to say, do you want a spiritual leader or religious leader to be called now? And one of our coalition members would say, I do want to show up and I want to walk through the incarceration, the hospital, the psychiatric. I want to walk through this to just give some comfort to the person, even if they do have to be put in the hospital. And again, Olivia, if you want to comment, because you've heard us say this before, that's a simple thing that we're not necessarily saying first responders need to understand the whole religiosity scenario. We do want to prevent the quick diagnosis that it's sick and crazy. Olivia, you want to comment? Yeah.
Yeah. And, sometimes it may not be appropriate or timely to get somebody on scene when you're having this issue. But again, I put in the comment, maybe this is something that happens, like you said, when we pass them off to whoever they're seeing at the emergency department, that the comment be made that we need to look at this as a spiritual experience possibly, and to make that noted in their file, and then say, can you follow up to see if they have a spiritual advisor, or contact the family to see if they know who that person is, and see if they'll come to the ER or the ED to speak with this person. And I think just giving just that step alone, it doesn't cost anything to do that. It's a little time consuming. So of course it may hold up law enforcement and they may have to pass that off. But I think just doing that, even if it's not a spiritual experience, how is this going to be a bad thing if you're telling them that you value what they're telling you? Just like Carlito said, what do you need right now to help you? And you offer that suggestion even to them if they don't offer it, and see if that doesn't help to not only de-escalate the situation, but it also puts the power back to them to where they are starting to feel more empowered now about the direction of where things are going.
Olivia, let me say,
Yeah, go ahead.
no, Olivia, you just made me think as you were describing someone that a first responder finds someone and it's a drug problem. We're going to take them to the emergency room, and very often we're going to ask for the peer support, the addiction peer support person. Well, what you're really saying is we may need to suggest a faith support person.
Yeah, and I mean, it only makes sense. I mean, even looking at our Fatal 10 research, the leading thing that we talk about that boils everything down is relational purpose. And I think at everybody's core, there is some type of higher power, whether you believe that to be a religion or a spiritual nature or whatever. There's something at people's core that helps them to understand that connection and being with people. And it all really does come back together. So why not start there and at least give them a foundation to build on from there?
That was probably the one practical step we emphasized last time, and I'll emphasize it again because, and we'll go to another slide or two where, yes, we're going to eliminate the safety issue. But once a person is on the ER, in general, most hospitals have chaplains. Many chaplains are not familiar with the mental health crisis part, but we got some that are getting there. So there's two pieces here for first responders.
Hey.
Someone's on mute.
So two pieces. One, let's just say the person already had to go to the ER. The question of, do you want a clergy or someone from your religious spiritual? Do you want that person? That's a peer support. So that's one simple question. Number two, we do want to suggest, can you put this in the medical record that we're hearing a lot of religiosity? And there is something in the DSM that says it should be treated, not ignored. Those are the two things we're actually trying to say to first responders, because it doesn't take that long. You can't screen it, you can't figure it out, but those two pieces gives a person a chance to not be totally discounted. So we're going to go to another slide soon, but Olivia, do you want to pick out another question? And does anyone else want to chime in here verbally?
Leo had a question. He says, what are moral injuries of retirement? He said years and years of overusing substances, trauma, and that are long-standing and have never been healed, isolation, suicidality. How can spirituality help in healing?
I'm giving that to you, to Dr. Chatlos.
Yeah, no, I'll gladly take that one on, because the more we are learning about spirituality and spiritual experience, when we reach in and touch that core, Olivia, you were talking about, that sort of has a higher power knowledge, believe it or not, when we can do that, it's healing. It's that ability to reach in and touch the injury, touch the memories, touch the hurt, and accept that that was part of my life. And maybe it was a good part because it meant it had meaning. I had purpose in doing and going through that to give to the world. So spirituality, in my mind, is the source of emotional healing. We just need to teach people how to actually touch it and open it up, which is what we do with first responder PTSD trauma treatment.
Finding silver linings, right? And then the other thing I was going to mention is when I think of the word spiritual too is, and hopefully for Leo, if you could think of maybe the person has that community to go back to, right? A community to heal and remove isolation. Because you obviously, in all caps, you said isolation. Spirituality is completely the opposite of isolation when they can engage in like-minded community with the same people of faith, religion, etc.
I want to jump in quickly on the word acceptance. One of our colleagues here, if he wants to comment, I want to study a lot more about the term he brought into my awareness called radical acceptance. And that's actually a term, radical acceptance, because it is really hard to accept some of the trauma and moral injury. But I want to go, I love that radical acceptance of what just happened, and then turn to my higher power to help me be radically acceptance that you just locked me up, drugged me, discounted my spirituality, and I chose to forgive both the medical people, my family, etc. So anyway, I love the radical acceptance topic, way beyond what we could do here, but that is a real term. I'm going to move to the next slide to just make sure if we, do have time to continue, we do. So this was the question. We want friends, family, ER. Do you know there's a DSM code called religious spiritual problem? Will you make sure this is noted in the medical so the person has a chance to not be totally misdiagnosed? Calvin, you had this as kind of an overview of what we wanted to close with on our messaging.
Yeah, and I think we sort of already said this, so I'll say it again, that first of all, with a spiritual religious experience, the suicidal, the homicidal tendencies, intentions are not likely to be there, but as a first responder, that's the number one concern. However, once it's clear, there's no imminent danger to self or others, Carlito said, listen. Just listen for the religious or spiritual things. Be open-minded and non-judgmental. That's the trust. Just give the space for them to say, and you may even reach your hand out and ask them with open-ended questions. Might this be connected with religion, spirituality, trauma, what just happened yesterday? And as I think it was Carlito, you said, how can we help? Ask the question. And the next one we also talked about, who can we call to help you? So those two questions automatically dissolve some of the helplessness, give the power to the client, to the patient, and you've got a relationship if they can in any way engage in those questions. So this is how I would recommend we sort of open the awareness. Are we aware of religious and spiritual experiences? Not just to avoid traumatizing, but maybe to open an opportunity for real transformational growth.
So I'm going to add my piece to this. Again, I'm going to assume many people know Ernie Stevens and Crisis Cops and all his de-escalation work and speaking. It was a year ago, I shared with Ernie, I had a spiritual experience and it was misjudged and locked up. And he said to me, I don't know, 30 to 40% of his calls, his mental health crisis calls, had some kind of a religious or spiritual element to it. And he said he was trained by the Texas system to call it hyper-religiosity or religious fanaticism. All right, so that's when it gets a little extreme. And he would see Jesus and Buddha written all over, and people would be quoting scriptures. That would be an example of a religious experience gone to a pretty close edge, right? Mm-hmm. What he did, though, after I shared it and he started piecing it together, he took a year and he studied all the research on spiritual emergency. And he's a pretty good spokesperson now. And so I just want to offer that to the audience here. If anybody's interested, it's fairly easy to study what we're talking about, because probably since maybe for a good 15 years, spiritual emergency, spiritual crisis has been now on the internet. And so you can study it. And Ernie Stevens is a great example because he now gets, oh, I got to listen for religious and spiritual themes and not judge it as crazy. I need to stop and talk a little bit. So again, I'm going to invite, I'm going to just stop for a second before we do our close. Does anyone want to speak? And Olivia, you can keep helping look at the comments. Does anybody want to voice their thoughts, questions? Is this familiar? Is this new? Have you seen this when you're out on calls? Have you ever had it?
I do have one quick question for Calvin real quick. Calvin, I posted it earlier when you mentioned the psychedelics, because that's something that we're starting to look at a little bit more as far as some of the cutting research and stuff that's coming out. But somebody that's, using psychedelics, does that automatically open them up for more possibilities for a spiritual experience just because of the fact that their brains are opening up for that, type of experience?
Simple answer, absolutely. And one of the questions, the description under controlled conditions in research studies with the use of psychedelics definitely opens something, and the majority, overwhelming themselves, identify it as somehow related to religious or spiritual. Does it guarantee an opening? No.
Right.
But it promotes it. What, Olivia, you'd like this one. The MDMA ecstasy has been requested to be approved by the FDA, and their response initially was the results, 80% knew that they had it because it was so dramatic. Well, therefore, then it's not a true research, double-blinded, because everybody knows what they're taking. So it's too good, so throw out the results. But yes, it opens something.
Well, and that's why I love the fact that it does open that, but we also have to be aware that not everything's under controlled circumstances. And if these are getting reintroduced into the community, then we need to all be aware of these type of things as being more, the opportunity is there.
Absolutely.
I want to make a quick comment and a transition. So again, that's a whole nother topic. We have lived experienced team members who are now PhDs, experts in that area. And we can bring that in because that's way past my expertise. The difference is mine and many of us had it naturally. It was almost like we were on psychedelics, but we were no near drugs. Ours was a very natural. I don't know if she wants to chime in, but I see Laura Lee Scott here, and you are, obviously free to not say anything, but I'm glad you're here. We have many colleagues who have gone through the very natural experience of a spiritual experience and got misdiagnosed, locked up, etc. Laura, if you wanted to put any comments in or voice, within 1 minute left, would love to hear how you feel about what we're promoting here and supporting now 2 years later after we partnered. Is there anything you'd like to say, Laura? And she may not be there. So we'll see if that happens. I'm going to close with where we want to go next. So it's how do you want to support us? I did mention we're making a movie and a documentary. So our whole message is it's more than a movie, it's a movement. Please connect with us on email and LinkedIn. We have a Rethinking Mental Health Facebook page where we're talking about the next steps. We do have a docuseries in process. We have an Aware movement, YouTube, and a coalition that's happening in New Jersey that we want to spread around the United States. Olivia, you did invited us to the Shepherds and Sheepdogs Conference. This is a team of people. We have more and more who will probably be at the conference, but they're also on the Aware team, where our whole mission is we just want to wake it up. It exists. Let's stop pathologizing it. Let's stop locking it up. So we'll make these contacts known to you. So Olivia, if you see anything that needs to be said, heard, commented on, please close it.
Oh, yeah, no, there's lots of good comments on here. And no, I appreciate everybody for attending today. It really is just about making people aware and just, opening the minds to the possibility that this is something that exists. And again, it's just another piece of this pie that, regardless if it's not a spiritual religious experience, it's just the fact that we're being open, empathetic, compassionate, that these things are not always going to appear as we want them to, and that they may be scary to the first responder and they may be scary to the individual experiencing them. But if we can come together and connect in a different way to try to understand someone's experience in this world and make them feel valued doing it, we are all better for it. So with that being said, I think this was a great training today. In fact, I see many people asking for more, wanting to see more stuff and maybe a series. I really enjoyed this, and I think that you guys have a lot to offer, and you're definitely blazing trails in this.
Could we even just take a moment of what would the series be? Because today we went another step from the last time. If we could take one more minute or so, what would be the next levels? Because we're looking to propose training, real detail around this. This is still on the awareness.
There was a slide up there that talked about, who is there somebody I can have you talk to, those kind of things. The last few pieces of that slide were actually kind of a peer support thing, like you listen without judgment. It's, you may not want to hear what you're going to hear, but you need to listen because that's why you took on the role that you took on. So like peer support and mentorship kind of come together. And I would say that for me, it would be, as a first responder, would be the idea that I want to know kind of the hands-on things, like what would be something I could do? Give me a couple scenarios. Maybe we talk about how I need to interact, or some best practices, or things that I can do when I make that handoff at the ER, right? Because if these people are experiencing some of these things, some of them may be spiritual experience, some may be mental health, and some may be somebody just in a crisis in general. And you may, experience them again in your community, and you don't want to ruin that first time that you meet them and mess up everything in the future. So maybe some best practices, how to talk to people who are in crisis, some things to do, some tools that they can have under their belt to really kind of get ahead of this would be something I would like to see.
I want to bring Ernie Stevens in because the last we spoke, he said he did 15,000 admissions, 15,000 mental health admissions to the ER. And he said a good percentage had a spiritual religious element to it. So I want to bring him in because he's got that firsthand experience. Yeah. So maybe we could do a follow-up, finding out what else, because this is a series. This is still awareness. This is the series. We're serious about waking it up. We're serious about preventing moral injury. We're serious about stopping the incarceration of people that need to be shifted off to a peer respite, or to their clergy, or for their family to understand, oh, this is a Christian or a Buddha, this is a religious experience. Let's just stop the $13,000 that you're going to be charged by going there. Like, there's so many benefits for us to go further on this.
Absolutely. And this is about building relationships in your community with people that are living there, and this is the kind of stuff that by educating them through some of these things that are in their, in their communities, we can build those stronger relationships. Even if somebody has to be hospitalized, they're going to come out on the other side better for it if we can handle it better when they go in.
Yeah, excellent. So in our closing, if we can do a follow-up, we'd love to, for support to continue this, to help us support a docuseries. Our point about a docuseries is to get this out in mainstream in detail. So that's our way, to get it out into a television series where people can really study this and understand it. So thank you. We went a few minutes over time, but really appreciate it. And I think we'll see you again.
And if you guys have any other questions, send them along to Janet, and we'll make, or to us, and we'll get them to Dr. Chatlos and to Janet after the training. This is recorded, so we'll have it ready soon to download and be able to rewatch along with the first one. So thank you guys for everything. This was amazing.
Excellent.
Take care. Thank you.
We're wrapping up. We'll talk
Bye,
Monday.